How is it?
Yeah, no, I can see a lot of difference.
Okay.
So no, I can see new person.
Okay.
Niche ತುಂಬಾ changes ಇದೆ.
Today we have another lady for a nose job surgery. You can see from the front profile that she has got a thick skin, typical South Indian nose. So this skin and bulbous tip is a issue, and also we can see her dorsum, which is not defined, and also from the side profile we can appreciate the thickness of the skin, and all. You are not connected. So this is before surgery, the front profile of a patient having a very thick skin, broad dorsum and bulbous nasal tip. So this is immediately after. You can see how she has got a refined nasal tip, beautiful dorsal aesthetic lines on both the sides, reduction in the width of the ala base. So this is before rhinoplasty and this is immediate results. Before and after in the same frame. So this is before surgery. You can see she has got a depressed dorsum, thick skin, bulbous and undefined nasal tip, and this is immediately after. You can see how she has got a beautiful projection of the nose, and also you have to observe the change in angle of the nasolabial. So basal view of a patient having a bulbous tip, wide ala base and also unsupported nasal tip before surgery. So this is immediate results on table. So you can see how she has got a beautiful refined nasal tip and good projection of the nose, and reduction in the ala base also has been done in the same surgery. So it's got a good dorsal aesthetic lines, good radix, and overall projection has been improved for the patient. So this is before and after in the same frame. ಮೂಗಲ್ಲಿ ನೋವು ಹೇಗಿದೆ? ಮೂಗಲ್ಲಿ ನೋವು ಇಲ್ಲ, ಹೊಟ್ಟೆ ನೋವಿಲ್ಲ ಮೂಗಲ್ಲಿ. ಓಕೆ, ರಿಬ್ ಹತ್ರನೇ ಇರೋದು. ಓಕೆ, ಫೈನ್. ಚೆನ್ನಾಗಾಗಿದೆ ರಿಸಲ್ಟು. ನಾನು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡೋಕ್ಕಿಂತ ಜಾಸ್ತಿ ಚೆನ್ನಾಗಿ ಆಗಿದೆ. ಓಕೆನಾ? All right, so today is first day following rhinoplasty along with rib grafting for this lady. So as you can hear this, she has absolutely no pain, and this is not even just 24 hours after surgery. So this is the beauty of general anesthesia. So, and she's having discomfort in the chest region, and that is completely normal. So we expect 2 to 3 days of discomfort and pain in the harvest site, and after 3 days that is going to disappear, and she's already on normal diet. ಊಟ ಮಾಡಿದ್ರಾ? ಏನು ತಿಂದ್ರಿ? ಇಡ್ಲಿ ತಿಂದ್ರಿ. Okay. So because we have given her general anesthesia and the endotracheal tube that was kept in her throat for 3 to 5 hours during surgery, she's having discomfort in the throat. That is what she's saying, and it is again completely normal, and she started a normal diet. And I have told in the previous videos, after rhinoplasty surgery it is absolutely the normal diet that we take. There's no dietary restriction, hence the recovery gets better because of the good diet. ಊಟದ ಬಗ್ಗೆ ಏನು ರೆಸ್ಟ್ರಿಕ್ಷನ್ ಇಲ್ಲ, ಆಯಿತಾ? ಯು ಕ್ಯಾನ್ ಈಟ್ ವಾಟ್ ಎವರ್ ಯು ವಾಂಟ್, ವಾಟ್ ಎವರ್ ಯು ಲೈಕ್. ಓಕೆ, ಆ್ಯಂಡ್ ನೆಕ್ಸ್ಟ್ ಥಿಂಗ್ ಈಸ್ ಮೊಬಿಲೈಸ್ ಯುವರ್ ಸೆಲ್ಫ್, ವಾಕ್. Okay, don't lie down. Okay, just walk, and only at night you have to sleep. Okay, and keep your head elevated like this so that swelling in your face comes down. Okay, unlike other patients, you don't have much swelling. Swelling is also less. Drink a lot of water, hydrate well, because we are giving you a lot of antibiotics, painkillers and all that, so you need to drink a lot of water. Alright, so today is day 3 following major rib rhinoplasty for this patient. So we are removing the pack today. She's doing absolutely fine. She's been improving day by day. Actually, she had a lot of discomfort in the throat. That's because of the tube that we passed to give her anesthesia. She had sore throat issues. She had difficulty in swallowing fluids. And today she's doing fine. And we're gonna take out the pack that is kept inside her nose so that she'll be finally able to breathe. Breathe from your nose, yeah. Stay. So you're able to breathe from your nose now?
Yes, sir.
It's clear?
Yeah, it's all clear.
Alright, so today is 10 days sprint removal day for this lady who came to us with these complaints. You can see the pre-op there. She had a flat nose, very thick skin, difficult kind of a rhinoplasty. So this patient, now we have removed the spleen. This is just few minutes after we have removed the spleen. So you can see she has got a good refined bridge there. So which was missing before surgery. You can see very flat dorsum, there was no defined radix. So you can see the beautiful dorsal acidic lines, curves coming towards the tip, supratip region. And also you can appreciate the change in the angulation of the nose there. Solpa baggi. So you can see how it is giving a curvature from both the dorsal acidic lines towards the tip, and also the projection of the nose that has been done in this surgery. So I'll show you the other profile where you can appreciate the changes. So this is one other side profile. So you can see the augmentation that we have done. She still has quite a bit of swelling because this is just a week after the surgery. So the augmentation is done here at the radix, at the dorsum, dorsal acidic lines. So in the side profile, you can appreciate one more thing is that she has got a good tip support, which was missing before surgery. We have used a tip graft, we have used septal extension graft to give her a good tip support. So this has given her a very good projection of the nose, changing the nasolabial angle, giving her a more younger look, and also to appreciate the deep nasolabial folds there that is gone. So that's because we have increased the projection so that the deep grooves that were there on both the sides of the nose is gone. She has got a more tighter skin around her nose. And also I'll show you the other profile where so this is one more right side profile of the patient where you can see the obvious changes. So you can see the increase in the augmentation at the radix, dorsum, and also again the tip projection. She has got a very thick skin, so as we know that in thick skin patients we cannot do much changes in the tip. All right, so we have also done angulation change there. She has having we just removed the sutures there, so you can see some scarring there. So these things will go away. And this is one more profile. So this 45 degrees, appreciate the change. This area is got a good bridge. So this contour you have got, this is what is called as the dorsal acidic lines. So when the light is falling on your face, you can see the shining here. So which was widespread, like there was a diffuse light over your face before. Now this you've got a good defined aesthetic line. So in the side profile, you can appreciate. So there was some curvature there, deep here, and also you can see the eyelashes where it was and your bridge. Now because you have increased the height there, so got a good augmentation. So got a good curvature and also augmentation. So this is a nice bridge that you have got. So this is his side profile. So this is your right side, right? Okay. So this height, okay, you've got. And how is it?
Yeah, no, I can see a lot of difference.
Okay.
So no, I can see new person.
Okay.
ಮುಂಚೆ ತುಂಬಾ ಚೇಂಜಸ್ ಇದೆ.
Okay.
ಸೊ ಇಲ್ಲಿ ನನಗೆ ವಿಡ್ತ್ ಬೇಕಿತ್ತು,
So you wanted
ಹೈಟ್
height,
ಬೇಕಿತ್ತು.
So you got that bridge, right?
ಹಾ, ಚೆನ್ನಾಗಿದೆ ರಿಸಲ್ಟ್. ಸೊ ನಾನು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡೋದಕ್ಕಿಂತ ಚೆನ್ನಾಗಿ ಬಂದಿದೆ.
Okay. Happy?
ಹಾ, ನಿಜವಾಗ್ಲೂ ತುಂಬಾ ಹ್ಯಾಪಿ.
Okay. All right. So how is pain in the nose? You have any pain?
No, I didn't had any pain last.
Okay.
In the first 3 days, I didn't had anything. Till
Okay.
now, also I didn't had
Okay.
anything.
So you have any breathing issues?
No, no.
Okay.
Now it has been grown a lot.
Okay. Good. Okay. So you don't feel any blockage of nose?
Nothing.
Right.
It's completely fine. I'm able to breathe properly.
Okay.
As before.
Okay.
Hello all. So basically, I'm from Bangalore. I had a nose issue. I mean, I wanted to get an rhinoplasty. I have a broad nose, and I get to know about Praya Clinic from Instagram. Then I have consulted many doctors before come to here, and I got to know about Prajwal sir. So I consulted him many times, and also I have reviewed many patients over here. So I got to know that they got on a good results from here. So and also it was a budget friendly. Then I spoken with him. So, and I came to here, I consulted Prajwal sir, and he gave me good instruction, everything. He cleared all my doubts, and I got to admit in this prior to in 3 days, I had a rib pain, and after that, it was decreasing day by day. And now I don't have any pain over the nose and rim. I'm completely fine now, and I'm able to breathe properly. So, as before, I'm very happy with the results. So I'm very thankful to Prajwal sir. And